There are many reasons why people have heart attacks. The causes include heredity, being overweight, overstressed, having high cholesterol levels, smoking, or excessive drinking. But one thing is for certain, many of the risks are avoidable. Here's Dr. Lawrence Santora of St. Joseph Hospital in Orange with tips on heart health.
The known risk factors for heart attacks are high blood pressure, diabetes, high cholesterol, family history of heart attacks in your 50s, and a family member, that means a mother or father or a brother or sister, cigarette smoking, obesity, sedentary lifestyle. We've realized, though, that there's some additional risk factors that have been identified. We call these the emerging risk factors. One is called a metabolic syndrome, or a pre-diabetic phase, where people have these high triglycerides and they're obese around the stomach, and their blood sugars are just a little bit high, not in the range where we would traditionally call them a diabetic, but we find that these people are as at risk for heart attacks as a traditional diabetic person. We've also found that there's some other risk factors, like perhaps homocysteine, which is a breakdown of a protein in your body that may cause plaque formation. There's also another protein marker that we look for. It's called Lp(a). These are called emerging risk factors that we do in patients who have heart disease at an early age that we can't explain by the traditional risk factors that I mentioned. Of all the risk factors, I think cigarette smoking is predominantly it's the trigger. It's the thing that leads that causes the other risk factors to multiply. The preventative things, of course, is to modify all your risk factors. If you smoke, obviously don't smoke. If you're overweight, get your weight down. It's crucial, I feel, in any treatment of heart disease, no matter what type it is, whether it's a problem with the arteries, which we're talking about now, or the valves of the heart, or the muscle, to exercise. Aerobic exercise has a tremendous power to heal the heart and improve the quality of your life, but also improve your lifespan. It doesn't have to be very vigorous exercise. Maybe 30 minutes, 3 or 4 times a week will modify all those risk factors, except for the smoking, of course, which you have to do on your own, or your family history. But one of the treatments that I think are preventative measures is to identify silent heart disease in patients who have an intermediate risk. And what I mean by that is, we have scans now, electron beam CT scans or ultrafast CT scans, that can pick up plaque in the artery when you have no symptoms. And if you have a scan of your heart, they're called coronary calcium scans, meaning that if the coronary arteries have calcium in it, that means they have atherosclerosis or plaque. And if you can pick that up, and there's a lot of plaque in your particular body, no matter what your cholesterol is, we should modify your cholesterol with drugs. And we have been doing these scans on St. Joseph's campus here for over 4 years, and we have saved many lives by identifying these silent blockages. The patients have normal treadmills, they have no symptoms, they may have almost 0 or 1 risk factor, and we can determine, based on with this test, how to properly treat you. So I think the forefront, and I think we've been on the forefront in this campus, is identifying early heart disease with EBT scans, electron beam tomography scans, a high-speed CT scan. And I think that in the near future, these are going to be part of the guidelines put out by the National Council on Cholesterol Education. And these will be part of the workup of a patient who has cholesterol problems or risk factors.